Hi, I'm Dr. Tasneem Hassam, a research psychologist in the Department of Psychology at the School of Human and Community Development. I'm one of the co-founders of the online depression screening tool.
Hi, my name is Professor Samaya Lehe. I am currently the head of School of Human and Community Development, the school that produced this tool, but I'm also a co-investigator on this project, the mddsa.co.za depression screening tool.
Hi, I'm Matshidiso Bambo, a PhD fellow at the Psychology Department in the University of the Witwatersrand, Johannesburg. Depression rates are rising worldwide, and South Africa is no exception. Probable depression prevalence across South Africa varies from 14.7 to 38.8%. Public health resources are stretched beyond capacity, with only 0.31 psychiatrists and 0.97 psychologists per 100,000 people. GP, nurses, and other health professionals treat symptoms, but there is rarely time to screen for mental health difficulties like depression. Hence, depression is often undiagnosed until it becomes quite severe. Further, lack of awareness and stigma towards mental health challenges makes it even harder for people to seek help. The depression screening tool seeks to address these problems by providing a free, accessible, and easy screening opportunity, which also includes an option for free counseling, empowering individuals to take the first step towards care. The depression screening tool is hosted on an online platform called www.mddsa.co.za, designed for efficacy, efficiency, and accessibility. It minimizes data usage to keep costs low for users while offering a comprehensive resource, including individual self-help information and insights into depression and its causes. This ensures a user-friendly experience that combines screening with education.
The online screening tool is a free-to-access, easy-to-use depression screening tool that gives the user instant downloadable feedback regarding their depression risk level. Unlike other tools, this one is based on research conducted with South Africans. This is the simple step and start of an important journey towards accessing care. And thanks to our partnership with the South African and Depression Anxiety Group, if users screen medium or high risk, they have the option of being contacted by a SADC counselor, again at no cost. To make mental health care, especially depression, accessible to everyone who are unable to access care, either because of cost or limited access to healthcare services, by virtue of it being online and anonymous, users feel safe from societal stigma and labeling. Individuals' privacy is maintained, self-help tools are provided. The website includes information on understanding depression in very simple, everyday language demystifying it. Hence, through the website, we hope to create a society where mental health care is within reach for all and where seeking help can become normal. We hope also to raise awareness and break down the stigma surrounding depression.
If you use this tool, you know that it's based on evidence-based resources. It was developed by South Africans for South Africans. It's easy to access, it's free to use, it can be used anywhere at any time, and if you use it, you can have confidence in the result because it has an evidence base. And above all, following this, you have a counselor on call, again freely accessible. So it's designed for individuals with limited access to mental health care, particularly those who rely on public healthcare services. Our goal is essentially to reach the general public who often face barriers to specialized mental health support. But basically it can be used by anyone, available online anywhere, anytime. You're welcome to use it.
My name is Patrick Arbuthnot, and I'm the Director of the Antiviral Gene Therapy Research Unit, which is also an extramural unit of the South African Medical Research Council. So we, together with the team of synthetic organic chemists on main campus at Wits, a team of Professor Charles de Koning, looked at trying to develop a green method for making these ionizable lipids. So the traditional way of making ionizable lipids is that petroleum products are used to generate the precursors or the feedstock, the basic building blocks that are used to make ionizable lipids. So it was felt that if we could use something that was green and also abundant in Africa, that would be quite a good thing to enable us to have freedom to operate and not be dependent on patents of the so-called global north. So we set about this project with the team of synthetic organic chemists, and they took material from cashew nut shell liquid and they made ionizable lipids using these compounds which they extracted from the cashew nut liquid.
Hi, I'm Charles de Koning, Professor of Organic Chemistry, full professor since 2005, so that's 20 years. I'm actually a University of Cape Town graduate from 1988. Then I went to MIT to do a postdoc, then to University of Hawaii, and I'm what's called a synthetic organic chemist, and I've been doing this for, I don't know, 35 years or something like that. We really started this in earnest in April 2022. The project was funded by the World Health Organization and the Medicines Patent Pool. And now we're 3.5 years later, and we do have lots of, in fact, we've synthesized more than 100 ionizable lipids, and these are much cheaper than the commercial ionizable lipids that were used in South Africa, for example, in the Pfizer-BioNTech vaccine, or in other parts of the world, the Moderna-based messenger RNA vaccine, where the ionizable lipid in that particular case is known as SM102. Currently what we're doing is we've made about 100 different ionizable lipids, and we are checking whether they're able to deliver messenger RNA and express, just like the COVID vaccines, express the spike protein of COVID. And we've had quite a lot of success in this.
Hello, my name is Robin Clintworth. I'm a synthetic organic chemist working at Wits University. I got my degrees here and I also did my PhD here at Wits University. We're working on the synthesis of new ionizable lipids from biorenewable waste as a precursor chemical, specifically cashew nut shells. So it's the inedible shell that surrounds the nut. The nuts are obviously consumed by people all over the world, and for every nut you have a shell that just gets discarded. And those shells are incredibly rich in phenolic lipids, which turn out to be ideal precursors for ionizable lipids, which you can use for mRNA delivery, for the new generation, next generation of mRNA vaccines. So the first vaccines that were ever developed essentially used either modified viruses, like smallpox vaccine required the cowpox virus, and that actually doesn't infect humans, but it has enough of the same similarities molecularly to generate an immune response.
I'm Connor Stockley. I'm a third-year PhD student at the University of Witwatersrand, and my PhD is focusing on synthetic organic chemistry, and our team is aiming to address the issue of vaccine inequity in Africa, and this comes down to particularly two main markets that we are focusing on. The first one being that of transfection agents, and whilst the second one is that of raw materials for mRNA vaccines. Now, transfection agents is a large market, having about a market size of $1.3 billion, and most research facilities around the world are heavily dependent on these transfection agents. However, access to these is extremely expensive, and this severely hinders research and slows down academic research. Then for lipid nanoparticles, the raw materials for these, particularly ionizable lipids, are extremely expensive and are covered quite severely by intellectual property. And this leads to Africa only producing about 1% of the local vaccines that are distributed within the continent. And so this opens up a huge market for growing vaccine development within Africa, and there has been a strong push to increase vaccine production in Africa from that 1% up to 60% by 2040. Now, our lipids are produced from cashew nut shell waste, and this again addresses the issue of local manufacturing, as we can obtain this from African sources, and this limits the amount of raw materials that need to be imported from overseas countries, and that majorly reduces the cost, and in doing so hopefully we can find that gap in the market and address the inequity within African vaccine development.
Hi, my name is Phumzamente. I have a PhD in chemistry and I am part of the NanoBand team.
Hi, my name is Dr. Zakhele Ndala and I am part of the NanoBand team. So our innovative product was first conceptualized by Professor Nosipho Moloto in collaboration with colleagues from Mintech. It was conducted by PhD students who were me, Dr. Zakhele Ndala, Dr. Phumzamente, Dr. Ndibuo Shumbula, Dr. Thapelo Mufokeng, and Dr. Siyabonga Nkabindi.
This is where our innovation started. NanoBand initially started as a PhD project, and then when we realized how much potential it has, we decided to go for the commercialization route and applied for a patent as well.
Hi everybody, my name is Professor Moloto from the School of Chemistry. I became involved in the NanoBand project through my supervision of Dr. Ndibuo Shumbula. So we had a project where we wanted to do skin tissue engineering, and from there it ultimately progressed into what NanoBand is now. So in my lab we have obviously master's and PhD programs, and the idea is to do projects that can translate into something useful and commercial. So this is how we put together the team to actually work on NanoBand and translate the research that we do into something that is viable and can be used by the public.
So NanoBand is a three-dimensional scaffold wound dressing. It is different from traditional wound dressings because it doesn't just protect the wound from the external environment. It helps treat infection, it helps control the moisture within the wound, and then it also integrates into the skin tissue and helps the wound heal faster.
Hi, this is Ndibuo. I'm a representative from NanoBand. So NanoBand was originally designed in a three-dimensional format. Reason being is because diabetic foot ulcers, they actually penetrate deep, or they go deep into subcutaneous tissue, into on the skin. So normal dressings, they don't usually go and then interact with the skin in a deeper tissue level. So NanoBand is able to actually penetrate into deep skin. So what it does is that when you put it, you don't have to remove it at all. So the exudates or the fluids that the wounds create dissolve NanoBand, and then it starts releasing the active ingredients which we've put into the dressing, and then eliminate the bacterial infection, and then also accelerate the tissue regeneration.
We decided to come up with NanoBand because we realized that there is a huge issue with chronic wounds. Chronic wounds are wounds that don't follow the normal stages of healing. They might take longer to heal, and they normally or typically affect people with chronic conditions, especially people with diabetes. You find that their wounds get infected and then they take longer to heal. And in South Africa particularly, we have a huge diabetes problem, and the problem is projected to get worse and worse with time. As a result, NanoBand brings a solution in terms of helping people with chronic illnesses. So NanoBand is made from a three-dimensional porous biodegradable material. It also incorporates antibacterial nanoparticles, and all of these materials work together to help the wound heal faster. So the reason why it's important that the wounds heal faster, it helps the patients firstly spend less time in the hospital, and then it helps them do less visits to the hospital to change the bandage, because with most conventional bandages you have to go to the hospital multiple times to change the bandage, and you have to end up spending way more time in the hospital, and you also spend more money by being in the hospital longer.
Hi, I am Professor Andrew Forbes. I head the Structured Light Laboratory. It is the source of all the technology that goes into Button Optics, and Button Optics is the company that I founded. Why don't we go down to the lab and have a look at the tech. Welcome. Here we are in the Structured Light Laboratory. It's the source of all the technology that goes into Button Optics. We started this lab about 10 years ago. Its aim is to tailor and craft light in all its degrees of freedom. You can think of it like cutting and weaving a pattern, not into cloth, but into light itself. And over these 10 years, we've developed many very valuable, very sophisticated tools that other people would like to use. And how should we give it to them? We decided to do it through a startup company, Button Optics. The Button Optics is the source or the conduit of all the technology that we're developing in the lab that you see around you.
I am Bertus Jordan. I am the Senior Scientist and Technical Lead at Button Optics, a spin-out from Wits University. Button Optics started about 2 years ago. It's a spin-out from the physics department from Wits University. We are creating unique and powerful photonics instruments that help with creating structured light. Structured light is a novel technique that enables us to extend the capabilities of different light technologies. The main innovation of the spin-out is the technology that has been developed in the research group over the last decade or so. Structured light has come a long way from the first technologies that people thought about in the early 80s and 90s. We believe the technology has matured so that we can use certain kinds of display technology to change what a laser looks like. We generate different patterns, and we also enable different interactions with matter by tailoring the light. We believe that all new innovations start with fundamental research. So we want to assist many research labs to enable them to be more effective in generating structured light. We can also play a role in industry to make them more efficient and productive. Eventually, we want to touch the lives of people at the individual level, because there is applications for all kinds of optical systems, including healthcare, because the eye is an optical system. The problem we solve is something of technology limitations. Lasers have been incredibly effective in changing our world. It impacts systems such as communications, machining, diagnostics, to just name a few. Button Optics adds to the capability of laser systems as it's reaching its limitations. We create an expansive structuring of the different degrees of freedom of light, and this way we can extend this technology for the future.